Hello and welcome to Sweet Beginnings Midwifery Care educational video. My name is Marvelis Lopez, midwife.
I'm Jara Robinson.
And we want to thank Stephanie Rounds for being our model today. We're going to do something very nice and very interesting, which is teaching you to be more proactive about feeling for your baby's position, measuring and listening to your baby's heart rate when we are doing virtual appointments. So we are going to first ask Stephanie to get in a comfortable position and lay down, but she's doing this by herself at home. She's going to relax, feel comfortable. We are going to need measuring tape if you have just a regular metric tape, or we can use also paper one. So we're going to teach Stephanie. We're going to lift up all of our layers, and we have like conveniently divided her belly like in across, so for 4 different quadrants, for her to be able to palpate and feel, because that's the way we can know for baby's position. So we have here, as a reference, we have your pubic bone has that edge, which is the top side of the pubic bone, so you're going to feel like soft tissue, and then you're going to feel that edge that is bony and is hard. Can you feel it on you?
Yes.
So that top one is the one that we're looking for, not the bottom one,
right,
but the top one. And then that will take us exactly straight to where your uterus starts. So that's our reference. And then the other reference will be on the top of your belly. We're going to feel that roundness of the fundus. So for that, what we recommend to do is just, you're going to put the measuring tape. You're going to be holding it on the 0, and then just going to put it where you feel the edge of the pubic bone as that reference. And then you're going to use your tape to go straight up. And now you're going to take a nice deep breath in and out. You're going to relax all your muscles. And then you're going to use your hand to palpate where you feel that roundness. Is that going to be that edge where it is?
Right where my thumb is.
Perfect. So then you're going to put your finger there, and then that is going to give us a number. So you just, the same way as you have the one on the bottom, just put your finger there, and then just, you can lift it up so you can read it.
30.5.
30.5. Very good.
Okay.
And we know that everybody's measurement is going to be a little bit different. Like if I measure you right now, it might be a centimeter or so off. If Jara measures, it will be also a little bit different. So, but as far as we're not talking a huge difference, what we see is the accumulative of this, that you are growing as your pregnancy is progressing. Okay, so you can do it this way, or you can use just a regular measuring tape, whatever you have at home that will make it easy. We want mom to be very nice and relaxed and take nice deep breaths so that the muscles in their abdomen are going to be more relaxed. We are taking these techniques from the belly mapping workbook from Gail Tilley, Spinning Babies. It's a great resource, and you can find that online, and we have some of the workbooks here in the office so that you can borrow them. But basically what we're going to find out is what is the baby's position. We're going to use a doll for demonstration, so to see where is baby at, in what position baby is in. Okay, so the first thing that we're going to ask mom before even she palpates is, where are you feeling in the bottom part of her belly with her hands? She's going to be feeling for what is presenting. So these are the Leopold maneuvers, and they're like the questions that we ask, and she can use her hands to feel on each side, and then see what is down here, what is presenting, what is first to come out, basically. Is there anything there that is engaged or is not?
Nothing's engaged.
Nothing is down low. Okay. Do you feel more into the one side or the other?
Yes, more on my left side.
Okay, good. And then we're going to ask, where is the baby's back? So where is back? So, but for that, you want to use one hand to push in so that you're bringing baby to the one side, and then you're going to use then, in this case, your right hand to feel for what is there. Do you feel any firmness? Try to go on the one side and then see if do you feel anything that is firm. We're looking for baby's back.
Not until up here. Oh, he just moved.
Good. Yeah, this baby is very active.
Yes, he is.
Good.
Right there's a big firmness up here.
Okay. Good. So you feel one firmness on this lower
Mm-hmm.
left quadrant and then one on the top right.
Yes.
Okay. So we maybe identify the 2 poles of baby. Now go ahead and with this hand just gently push baby a little bit more against this wall so that you can feel a little bit better for that positioning. Do you feel any firmness on this side?
Yeah, right here. I feel
Okay.
more firm right there.
Okay, so we're thinking that possibly the baby's back then is on the left side right now?
Yeah,
Okay.
I would think so. Yeah.
Yeah. So do you feel like more smaller kicks and movements on what side? This side or the
They're
left?
like on both, but
This is giving us an opportunity to learn how to connect with our baby and feel those
over here it feels a little bit more on that side, on my right side.
Okay. So possibly we're talking about one pole on the lower.
Oops,
It's okay.
down there.
Lower left, another pole on the upper right, some firmness that you
Yeah,
feel
it's like
on
right in
this
the
side,
middle right
in the
now.
middle right now. So then in the middle, and then we feel more firm surface on
Yeah,
on
right
the
here.
right side. So it is possible that what we are feeling then is this.
Mhm.
Do you feel any kicks or movements over here that
They're
are
like-
like little?
Oh yeah, like here and then down here.
And down here a little bit of like
Mhm.
more wiggle movements. That
Mhm.
could be the hands. The head will be something that is more like there, that it probably can move a little
Mhm.
bit. But then a bottom is something that will bulge and roll. Does that feel to
Oh
you?
yeah, that's definitely what's
Okay.
here.
And then a back is going to be firm. Well, that's what we're looking for. Yeah.
Mhm.
So we could either find a baby that is, in that position. It could be that if baby's more in that occipital anterior position, we are not feeling much of those movements like kicks and little wiggles, but more like bulge and rollings on the top. Or if we have a baby that is a posterior, it could be more kicks on the front, a lot of this movement. And we're not really going to find that firm back in either side because baby's more in this position. So that will be posterior. This is very valuable information for us because depending on what moms are feeling and what we are feeling when we are here in the office, it allowed us to know what exercises, positioning recommend for baby to have an optimal position for birth, which will be that occipital anterior. Okay, so this is the information that we're gathering so far based on what you're feeling. Very good. And then now we're going to learn a little bit more about movements with Jera.
So I'm going to be explaining to you guys kick counts, what they are, and how to do them. So we call them kick counts, but in reality, kick counts really are just anything that you perceive as movement. So ideally, kick counts are something that you would want to do for 3 days in a row at the time you feel like your baby is the most active. So are there any times that you feel like Mr. Arden here is more active, or is it kind of throughout the day?
Oh, throughout the day.
Perfect. So with Stephanie's baby, she feels him moving consistently throughout the day. For you, it might be at the end of the day when you're more relaxed, when you're winding down, that you really feel your baby come alive and start to have their little party time. So there are tons and tons of apps out there on the App Store that you can use because almost everybody has a smartphone these days. And ideally how it works is anytime you perceive movement from your baby, you'll use your app, or you can go old school and use pencil and paper, and you'll make a tally mark for any time that you feel your baby move. What we would like to see is 10 movements in 2 hours, and you want to do a baseline for 3 days. That way you kind of get a consistent rhythm and you learn how your baby moves, and you learn, oh, I know that it takes my baby 47 minutes to move 10 times, or in Stephanie's case, it takes my baby 5 minutes to move 10 times. So whatever is your normal for your baby, and this is the most accurate and the easiest and most convenient way for you to stay in tune with your body and with your baby, and let you know that your baby is happy, healthy, and active and moving all the time. And it's good for us to know when we're doing these virtual appointments, you know that you're feeling your baby moving consistently all the time. So after you do your kick count, what you want to do is, when we're doing a virtual appointment, you can do listening for your baby's heart tones. So just like with the kick count apps and monitors, Same thing if you have a smartphone. There are tons and tons of apps out there. I think I saw today like 12 this morning of different apps that you can use. So when we're in the office, normally we use a Doppler, or sometimes we use a fetoscope, depending on mom's preference. But you can use this to track your baby's heart tone. So the one we're going to be using today is the Bella Beat Shell. And if you look, it has a little purple bee that you can use on your app store. And based on Stephanie's palpating, she feels baby here on the lower right quadrant. So then you'll go ahead and use your smartphone, and then you'll press start listening. Once you find your baby's heart tone, you can go ahead and click record now. Perfect. And then once you're done, then you'll hit done and it'll automatically save your recording. Ideally, you want to do that for at least a minute. That way we can go back and count your baby's heart tone. That way we can hear the variability and how they're sounding. Normal heart tones that we like to hear are somewhere between 120 beats per minute to 160 beats per minute. So that's just a really easy and convenient and free way for you to be able to check on your baby's fetal movements and your baby's fetal heart tones without ever having to leave your couch when we're doing our virtual appointments. Thanks for watching a Sweet Beginnings Midwifery Care educational video.
We're here to serve you. If you have any concerns or doubts, please refer to your communication handout and call your primary midwife phone call. We are here 24/7 to help you with any doubts. Have a wonderful day.